Aletha Maybank is here to tell us more about this story. Now, we've talked about this story on and off here in our Rise, and so what does this now mean for women who fit into this category?
Sure. So, this past June, the Supreme Court actually ruled that human genes cannot be patented. So this is really why Quest was really able to take this on. The company that was doing this no longer had the monopoly over this. And it's really providing an opportunity to offer the BRCA1 and BRCA2 tests. We heard about it a couple months ago when Angelina Jolie came out and announced that she was having a double mastectomy because she found out she had this particular gene mutation. And BRCA is really, if it's not mutated, actually suppresses the growth of cancer cells. But when it's mutated, it does. And as you said, 80% chance of getting breast cancer if you have the mutation, and 40% chance of getting ovarian cancer if you have the mutation. So now this provides women an opportunity if you have a family history, and that's very important as well, because the United States Preventive Task Force recommends that only if you have a family history do you really go for this particular testing, and you really should talk to a healthcare provider about this. But it does offer an opportunity for women who do test positive. Now, if you test positive, it doesn't necessarily mean that you're going to get breast cancer or ovarian cancer, but it does put you at risk. And now it gives you this opportunity to have different screening options, treatment options, and really be a little bit more in control of what your choices and decisions will be about your future and health for women who do test positive for this particular mutation.
I mean, because obviously what speaks out to me is that there would be a number of different factors. Even if you test positive, these tests would allow you to make these decisions. Obviously, it's, the propensity of it in your family, whether or not what your living and working environment is, correct?
There are so many different factors, and then for each one, I think, and that's an important point, I think for each woman, her choice is her choice. Angelina Jolie made her choice, and you've heard a lot of people give her, a lot of flack for her decision, but it's really her choice. It's her body, it's her lifestyle, it's her family, it's what she feels comfortable with. And I think that's a very important point that every woman, and the important point also is that she has an informed choice and an informed decision, that she has a lot of conversation and a lot of support about what she does if this test does come back positive.
Okay. Let's move on to BPA and miscarriage.
Yes.
Tell us about that.
BPA, so bisphosphonates A. This past week, one of the major reproductive medicine associations here in this country had a conference, and they really wanted to bring light to the hazards that certain chemicals bring during pregnancy and have risks towards the fetus. And this particular one, BPA, which actually has been found, the FDA says no longer can be in bottles because it found it's very risky for babies. It's a particular substance that's found in almost any kind of plastic that we have in this country. It's found in flooring. It's found in so many things. If any of us tested for it, we most likely would be positive for it in our urine. And so what they did was they followed 115 women when they were pregnant who already had a history of miscarriage or infertility. 68 of these women in this particular study actually miscarried as a result of this study, as well as 47 had live births. When they looked at the women who actually miscarried, 80% of them were at risk for having BPA and higher levels of BPA. So this is a very compelling study, because while it doesn't necessarily show a direct link, we're very careful about not saying that in medicine, that one particular thing is linked to another, but there's more of an association. More studies down the line with larger samples may actually show that there is a link between BPA and miscarriage. So it's a really compelling study. And so, BPA, which is found everywhere, we say at this time to really avoid cooking or heating anything in plastic. Don't put it in the microwave. Limit the amount of canned foods that you have, because BPA many times is lined on the metal. Don't leave water bottles out in the sun either. Also a very big risk of getting BPA and seeping it into the water. Wow,
certainly some good information. Now, on to another drug that has made the scene in a very negative way, crocodile.
Yes.
There's a reason it sounds like crocodile, because it is a flesh-eating disease.
Well,
it creates it, right?
Right, in a sense. I mean, it definitely can tear the body up. And
tell us what it is first.
Sure. So this was found about 10 years ago in Russia, and this is where the concoction comes from. So it's codeine crushed tablets mixed with gasoline, mixed with paint thinner, mixed with red phosphorus, hydrochloric acid, and basically injected to the needle. So you can imagine, it doesn't take, a particular scientist to really understand that this is going to do some danger to the body. And, it's 3 times cheaper than heroin, however, 3 times more potent. the time period of which it lasts, the high is about an hour and a half, where usually heroin's about 4 to 6 hours, so people are using it pretty often if they are using it. Now, the United States, the DEA has really been following this for about since 2011 because they got word about that it might be coming to this country. What they are now seeing, but they have not quite admitted to it yet, is that they are starting to see some cases show up here in the United States. And there are some cases in which women said they have now bought tainted heroin in which they didn't even know what was in that vial, but they started to show up with tremendous scars. And what happens is when you can imagine, you inject something like that into your veins. Exactly. You inject something like that into your veins, you can see the damage that it causes. I mean, it basically erodes your body and your skin to where you're just seeing flesh and bone.
Better than any anti-drug commercial I've ever seen.
Yes.
So let's end happier. Sleeping kids. I have 2 little ones, and,
Yes.
and I don't need a science report to tell me this, but
Really?
sleeping kids and acting out, give me the correlation.
Well, what's interesting about this study is that, they followed 11,000 children, which I think was remarkable from the time that they were born, and they tested them for their sleep habits as well as their behavioral habits at the ages of 3, 5, and 7. When I was growing up, I was told I had to go to bed early so that I could be refreshed and that I'd be good for the next day. But really what this study is saying is that kids who have behavior problems, it's not necessarily, the time of day that you go, it's the consistency that you have. So if you're putting your child to bed at 8 o'clock every single day, less likely to have behavior problems. If you're putting them at 10 o'clock the same time every day, less likely to have behavior problems than if you're switching it back and forth and back and forth. And that's what this, study is showing. But they do recommend, if kids are from K through 8, they really should have 10 hours of sleep every single day. 3 to 4-year-olds should have about 11 to 13 hours of sleep with some naps in between as well. But, if your child is that child that wants to stay up a little longer, some kids can handle it.
Which would explain why so many adults, especially in our business, are cranky.
Exactly. Exactly.
Dr. Aletha Maybank, thank you so much for joining us. And
You're
we look
very
forward
welcome.
to your next set of findings.
Yes, thank you.
And thank you for watching Arise America. I'm Gary Anthony Ramsey, sitting in for Debbie Turner-Bell. She will rejoin you right here tomorrow.